Well, I've been thinking about my physical therapy a lot because of the fact that um, my physical therapist doesn't seem to understand Ehlers-danlos as much as they would say they do. The reason I say this is because of the fact that my insurance company has only allowed me to have 45 days of physical therapy a year when I should be going 3 times a week. And then on top of that, my physical therapist will not help me relocate my bones into the proper position that I need, which becomes a struggle because I can't always do it because I don't know everything that I'm doing is correct because I have not been trained to do it. And with the physical therapist, they only want to concentrate on one part of the body at a time, not overall strength or things like that, because I'm very weak. And yes, I am overweight even though I can't eat correctly. I don't think a lot of it is my food choices, but I know that's a good chunk of it because what I can eat right now is potato chips that I dissolve in my mouth, some of those beef sticks. What it is it's ground up beef jerky basically put into a casing that I peel off, and then I suck on that until it falls apart, and then I usually end up drinking several of these to eat a meal. I usually go through about 2 of these for every meal. I get lightheaded when I don't eat appropriately. Also, I get lightheaded if I have to fast for a test, to the point where I've passed out several times. Roughly 2 years ago, I had to go for a colonoscopy, which is kind of strange at the age of 33, but I was 31 at the time. And the first time we tried having me fast and take the stuff to wash everything out, I passed out. The second time, I was not doing well at all, and I called ahead to the doctor, who then called ahead to the emergency department and told them to give me bags of fluid and pain medication, which, because I'm allergic to codeine, I usually end up getting morphine, which the hospitals are not too happy about having to give me, especially hospitals that don't know me. They don't understand why Tylenol doesn't work. It's because it's been something that, like, I've taken like an aspirin regimen all my life because of being in pain. And with the stuff with physical therapy, I'm really not sure that they can do everything that they need to for me that I need. So I probably am going to have to find a new physical therapy office. Possibly it'll have to be one without van service, which means I then have to try and figure out how I'm going to get there. And also on top of that, I have to see what all can be done for me. So basically, I'm stuck back at square one trying to find a physical therapist, and 2, trying to find a way to get there to be able to keep up my progress, because we don't have a car. And since we don't have a car, it makes it even more difficult because there's only a few physical therapy places in town, and I think only 2 of them have van service, and I'm not sure if the other one that has van service even takes my insurance, and if they do, if it covers for the van or not. And then I'm kind of stuck with the whole, I have paperwork for working on my legs and my elbow only. Other than that, I have no paperwork to do physical therapy. So if I stop going because they're not helping me do the things that I need to do, there's really no sense in going. And it's sad because I know I need physical therapy. I know that I need some type of physical exertion that won't damage me. And normal physical exertion damages me every day. We currently have our bed on the floor that I'm, currently laying on to film this. And I get up from the mattress with the help of Jesse holding my hands to stabilize me, and then sometimes I'll get dizzy and lightheaded and fall straight away. Other times I can get up on my own with my braces on and be perfectly fine. I don't know if it's because of, the speed that I move when I get up, if that's what's causing me to faint, or if it's because I'm in pain somewhere, because my reaction to pain has become either I pass out to forget it or I throw up when I'm in a lot of pain. So it's kind of scary to have to deal with that every day, several times a day. I know the vomiting's not good. Believe me, I know the vomiting's not good. And it's just so difficult sometimes. And Monday I go for more tests, and then depending on what this test says, I go back to genetics for more tests. And it just keeps happening. It's hard to keep having to go through test after test after test. I thought when I got the diagnosis of Ehlers-danlos hypermobility that the test would be done. But seeing a doctor to get finger splints to try and help me be able to use my hands, they said that this is not Ehlers-danlos, what's happening to my hands. And it's possible that there's something else going on. My neurologist is mainly looking at MS as what could be wrong. Jesse doesn't know all of it, and I don't want him to until it's time. I have to go. He's going to be back from getting me pain meds. So, bye.